Good afternoon, Hattiesburg. Thanks for joining us for this COVID-19 briefing for Wednesday, December 16th. We'll start with today's hospitalizations. In the hospital right now between Merit Health Wesley and Forrest General, we have 111 people who are COVID positive. That's almost 10 over where we've been for the last 14 days, with another 3 under investigation. And of those 111, 31 are in the hospital, 31 are in the ICU right now. As you can see, we continue to add new lines to this graph, and that's a very unfortunate circumstance. In the summer, back in that late July, early August spike, we got to just over 100. Now we're breaking new ground as we've crossed the 110 threshold, now at 111. Statewide today, there were 2,343 new positive cases reported, with 42 new deaths reported, and unfortunately, there was one new death reported yesterday in Forrest County, which brings our totals to 93 in Forrest County, 52 in Lamar County. We send our condolences and well wishes to that family. New positive cases today: Forrest County reported 43, Lamar County reported 57. Another day where we are over 100 in terms of new positive cases. Those kind of days where we're having these big influx of new cases are having consequences when it comes to hospitalizations and otherwise. To date, Forrest County has seen 4,581 new cases. Lamar County has seen 3,568. Our 5-day average, we're still well above where we need to be in terms of trying to bend this curve. But again, another day where we were over 80. The other number that's concerning us is the inside 14-day number. We've seen this number kind of hit new ground in each county for the last several days. This inside 14-day number is the number of people who have received their positive test result within the last 2 weeks. It gives you an idea of how many active cases we could have in our community right now. And so in Forrest County, that number now stands at 634. In Lamar County, that number now stands at 549. As you can see, we are, again, breaking new ground in a very bad direction. Each day, now getting close to the 1,200 mark in terms of potential active cases in our metro area. Compared to a week ago, Forrest County was at 544 inside 14 days last Wednesday. Today we're at 634. Lamar County was at 443 a week ago, now at 549. So increase of almost 200 potential active cases in our community in just 1 week's time. Hospitalizations, we were kind of been at 109. We dropped back down over the weekend, but now we're back up to 111. ICU admissions, however, are down. Our goals remain the same, and that's trying to protect the vulnerable, people who are over the age of 60, people with underlying or chronic health conditions. We want to prevent overrun of the healthcare system by slowing the spread. And speaking of that, we want to give you an update on hospital capacity. As of this morning, Forrest General had 4 acute beds available and 2 ICU beds available. Merit Health Wesley has 6 acute beds available. They're already 4 over their initial ICU capacity, but they can add 2 more if they stretch it. As we always talk about, hospital capacity changes throughout the day, and so you'll see hospitals discharge throughout the morning and then pick back up in the afternoon as ER visits turn into admissions and as surgeries come out. And so this has been a challenging season right now for our hospitals. I know that we have a lot of doctors that are working overtime trying to take care of people because it does require more manpower when there's a COVID patient in the hospital. Things that we're doing, strategies that we can employ to accomplish our goals: widespread availability of testing, wearing masks, watching our own data, listening to all voices. Those voices that we bring to the table every Wednesday in our weekly conference call include both our hospitals, HATTESBURG Clinic, our emergency management personnel, both counties and our local government, school districts, universities, all sharing information every week on this call. There's some tough statistics here from HATTESBURG Clinic. The positivity rate we've talked about the last several weeks. It's the percentage of total tests that came back positive. And so during October, when we kind of saw this sort of small spike, we were at positivity rates of 10 and 11%. As November wore on, we started to pick up, and now we're kind of in some new territory of 16.3% a couple weeks, 60.4%. So far this week, we're only at 14.5%, but there are a lot of tests that are pending right now. And just to give you some context, last week, HATTESBURG Clinic had more COVID positive tests reported than in any 1 week period since this pandemic began. They had 495 new positive cases, and that's just HATTESBURG Clinic. That's not Forrest General. That's not any of the other healthcare providers. That's a lot of new positive cases that came on the rolls last week. So increased positivity rate, increased total number of positives coming back. We also look at some other things, the percentage of new cases under the age of 20. Ideally, while you don't want anybody to get COVID, you want this percentage to be as high as possible because typically, not always, but typically younger people do better with this disease than older folks. And so, we had the small spike in early October, that week of October 11th. The percentage of new cases under the age of 20 was as high as 30%. But since then, that number's come down. And so over the last weeks, we've been between sort of 16 and 18.5%, which means that you're starting to see the average age is going to be up higher as well. And so back in that same early October spike that I talked about, when your average age is 36.5 to 39, you're not going to see as many new cases translate into hospitalizations and ICU admissions and deaths. However, when you start getting into the 40s, the low 40s, mid 40s, you're going to start seeing new cases turn into hospitalizations. But there's a new stat that we looked at today, and that was the percentage of new positives over the age of 70. These are in an age bracket that's incredibly vulnerable to having an adverse reaction to COVID if they get it. So when we were coming down off the big spike in July, the week of August 2nd, even though we were having a lot of new cases, it was only 3.5% of those were over the age of 70. However, as we started this most recent spike in mid to late November, that percentage of new positives over the age of 70 is now increased fivefold almost to 16.2%. When you have increased positivity rates, increased positive tests coming back total, when you see the average age in the low to mid 40s, and when you see your percentage of new positive cases over the age of 70 hitting 15, 16%, you're going to see a lot of these new positive cases end up in the hospital. And the bad news really is that the Hattiesburg metro area has set new records for potential active cases for 8 consecutive days. That inside 14-day number that I talk about, when you look at the entire metro area, Forrest and Lamar County combined, for the last 8 days we've set new records. And that's translating into hospitalizations. And hospitalizations will continue to increase when you have more cases coming in. But even today, we had already set a new record of 111 hospitalizations. And so not only is this putting people at risk, but we're also putting strain on the healthcare system. Some positive news, however, we all kind of saw this in the news. The Pfizer vaccine has been received by both Forrest General and Merit Health Wesley, and their frontline staff are starting to get vaccinated this week. Forrest General saw 25 vaccinations thereabouts yesterday. They're trying to vaccinate another 50 every day for the next week until they get the staff that are going to get vaccines taken care of. A lot of folks have been asking our office, when can I get a vaccine? And the problem is that you've only got one right now that's approved, Pfizer. And hopefully Moderna will get FDA approval as well. But either way, the Department of Health, and I encourage you to go on there and look at their vaccine plan. It's very thorough. The priority is going to be frontline medical staff and then residents and staff of long-term care facilities. We don't know of any long-term care facilities yet in Hattiesburg who have received their vaccines. When we find out, we'll certainly let you know. But this is going to be the first phase, this phase one of getting people their vaccine. And so it's important to understand, bottom line, that widespread vaccine availability is still a long way off. And so we must continue to do those things individually and collectively to protect ourselves and protect the vulnerable. And we all know what those things are. It's wearing masks, it's practicing social distance, and it's avoiding any unnecessary gathering right now. Those are the things that we have to continue to do to buy us time until that vaccine is widely available. Finally, our act of courage. Today was the official send-off for Chief Anthony Parker. Chief Anthony Parker has been the police chief for the Hattiesburg Police Department for the last 5 years. But before that, he was at Crystal Springs not only as a patrolman, but also as their chief. And even before that, he was with the Highway Patrol. And so 39 years total in law enforcement. And I can tell you, go over his career highlights, but I can also tell you what he meant to me as a new mayor some 3.5 years ago. For me, he has always been a voice of wisdom and wise counsel. He is someone who has encouraged me. He is someone who has given me words of restraint sometimes when I was moving too quickly. But he is someone that I'm so glad was at the table throughout this administration because we are a better city. We made better choices. We did some really great things when it came to law enforcement and community policing because Chief Parker was there. When he came to our department in 2015, it was on the heels of a tragedy. of losing Officer Tate and Officer Dean. He united not only the department, but he served as a unifying force across the city when there were a lot of competing interests. And he's brought that same coach mentality of bringing the team together throughout his 5-year tenure here. And a lot of things have been accomplished. We've going from low 90s in sworn officers to now consistently over 100. We've worked together to establish pay scales and to have continuing education opportunities for officers to get college degrees. All of those are because Chief Parker championed those things. And our department and our city is better off because he was here. And we wish him and his wife Betty and their 2 children all the best in their next chapters. As we continue on in the week, remember to wash your hands, take care of yourself, wear a mask if you go out in public, do only what is essential, and remember, you're safer at home. Be careful, and we'll see you later.